Welcome back, everyone. My name is Morgan Overton. I'm one of the organizers of this event, and I am pleased to introduce our next speaker, Vanessa A. Vassell, National Programs Director for Maternal Health and Environmental Justice, is a maternal health epidemiologist and full spectrum doula whose work centers the life saving scope of practice of Black, Brown, and Indigenous community based doulas, midwives, and ancestral birth workers. Her middle name, meaning power to the people, is the spirit of who she is and gives purpose to all she does. Over the past 12 years, Vanessa has developed her maternal health and disaster management knowledge and skills at such agencies such as the CDC, HRSA, Planned Parenthood, March of Dimes, the American Red Cross, and the Harvard T.H. Chan School of Public Health, as well as local and state health departments in Georgia, Florida, New Jersey, New York, Ohio, Tennessee, Vermont, and West Virginia, just to name a few. Vanessa advanced to PhD candidacy at Florida International University, studying maternal and child health promotion and disease prevention as a McKnight Doctoral Fellow. Vanessa is a proud graduate of the University of Washington, where she studied urban health and diversity at the undergraduate level, and Meharry Medical College, where she studied public health practice at the graduate level. Thank you, Vanessa. Take it away.
Excellent. Thank you so much. Can everyone hear me? I hope you can. If not, just put it in the chat and I will fix my audio. But I'm so grateful to be here today and so excited to have a conversation about the resiliency of mothers and families in Flint, Michigan, as well as across the country in places that Black Millennials for Flint serves as it pertains to eradicating lead exposure in Black and Brown communities. So what I'm going to do is I am going to share some brief slides and we're going to have a conversation. I'm hoping that when I show my screen, you won't see all my notes, but we also know we are living in tech world. So, okay, Chrome tab, here we go. All right. And also feel free to send a chat if you cannot see my slides. All right, great. So today, like I said, we're going to talk a little bit about environmental justice and reproductive health, as well as environmental justice and maternal health specifically, and kind of how those two things intersect, and more so how we've been seeing the presence and impact of doulas and community birth workers who have been at the helm of advocacy and activism in this intersection between environmental justice and reproductive health. So just quickly, I'll talk a little bit about my organization. I'll talk a little bit about the program that I lead, the Maternal Health and Environmental Justice Program, as well as how this intersects with reproductive justice, and highlight doulas that have been showing up in the movement, as well as for those of you who are doulas and birth workers in the audience, how you can continue to show up in these movements that intersect to impact our families and to protect our communities. And so I actually do want to give a shout out to these three beautiful queens in this picture. Latricia Adams is our president and CEO. I'll talk a little bit more about her. She is all the way on the left-hand side. All the way on our right-hand side is the director of Black Swan Academy, which is an organization that is doing amazing work across the lifespan of girl to woman. And so I also will talk about that as it pertains to environmental justice. And the beautiful Mari, who is also known as Little Miss Flint, who has been living in Flint her entire life and decided to dedicate her life to activism and advocating for her community at such a young age. So we are particularly proud and excited for the work that she does. So a little bit about Black Millennials for Flint. So we are the first and only civil rights organization dedicated to the eradication of lead in Black and Brown communities. Specifically, we have the way that we started was actually a community service project that eventually turned into its own 501c3. So the Greater Washington Urban League Young Professionals, shout out to them, had a service project around the time that the Flint water crisis hit the national news, which was around April of 2014. And for those of you who don't know a lot about the water crisis, I will talk about it a little bit, but I'm not going to talk about it in depth because what I really want to center is take home take home tools and tactics for protecting your community against the ills of environmental racism and the challenges that are having with the intersection of climate change and trying to protect our health. So I'll talk about that in a couple of slides. But back in April of 2014, for a quick overview, in the community of Flint, Michigan, the water source, which was originally in Detroit water systems, was switched to the Flint River. And historically, the Flint River has been polluted with lots of industrial waste from the times when Flint was a booming industrial city, in particular for car manufacturing. And so when this decision was made, which was made for cost saving reasons, not for healthful reasons, as you all know, to this day, that exposed the citizens to toxins, to poisons, and specifically to elevated lead. And in addition, it wasn't just what was in the water, but the pipe system of the pipes. And so even when they attempted to switch it back, a lot of the damage had already been done because of the lead pipes that were throughout the city and still are throughout the city. And so the reason why this horrendous situation was the birth of our organization is because the folks that were in the Greater Washington Urban League in Washington, D.C. were outraged by, this primarily Black city being impacted the way that it was, and wanted to have a community service event, which was to bring water to the city. When they realized that just bringing bottled water wasn't going to be enough, 3 of the members of the organization decided to create a total separate organization, which became in 2016 Black Millennials for Flint. So that's kind of how we were born. And so I do always kind of like to tell that story because if there is anyone here listening that's maybe a student or a community organizer or an activist and you're working on a project in your community and you feel like you want to do more, or there's more work that needs to be done and you need more capacity, it's a possibility that your project may actually turn into a longer term solution for your community. And so our current staff, including myself, would be Dr. Latricia Adams, who I mentioned, Josh Perkins, as well as Michelle Mabson, who is also an environmental scientist. And then we have three additional staff members that just joined the team, including Deanna Brown, our National Youth Program Director, Lauren Owan, who is our Baltimore Programs Director for Health and Wellness, which I'll talk a lot about the 4 cities that we serve, Baltimore being one of them. And we have one more staff member who just joined the team, who will be serving Memphis. Which technically, I guess she doesn't start till Tuesday, so I won't drop that news now. But we're really excited that our organization can grow with all the needs that are in the communities that we serve. So we serve 4 communities, like I mentioned: Flint, Michigan, Baltimore, Maryland, Washington, D.C., and Memphis, Tennessee. And I won't go into detail on this too much, but for those of you in the audience who may be stakeholders or, this may be of interest to you as it pertains to getting more involved with our organization, what we do is we raise money to try to improve the situation in our 4 cities and beyond as it pertains to lead exposure. We also are huge advocates for all aspects of environmental racism and pollution, which oftentimes includes air, consumer products, food, housing, soil, and water. The food movement, as you all can imagine, is huge right now as it pertains to the discovery. Well, I shouldn't say the discovery, but the pulling back the curtain on the toxins that are in food that are sold in specific communities. And as it pertains to maternal and infant health, it was just exposed how much lead there is in prenatal vitamins and how much toxins and specifically lead, trace lead levels there are in baby formula and in consumer goods sold as baby goods. And so we have also kind of increased our presence in this area of food as well as consumer products, beauty products. We know are unfortunately this idea that there's clean beauty and then there's everything else, but all beauty should be clean beauty. But that's another conversation for another day. Educate and equip the general public with digestible information about lead and lead exposure. I'll hopefully be doing that today. And of course, if it's not digestible, please ask questions. And or if you think of something, you can reach out to us on social media. And last but not least, a big part of my conversation today will be about the coalitions that we build as it pertains to birth justice. So let's talk about lead exposure as it pertains to maternal health. I'm going to take a step back and talk a little bit about lead exposure in children. And the reason I kind of like to start there is because when you think about lead exposure in children, there's generally two approaches. Um, when before a child is born or when a child is small, you may have the health department or somebody contact you and say, with a pamphlet, or maybe WIC will contact you and say, hey, we may want to give you some information and education about lead. It may be the paint in your apartment or your home. It may be, we want to test your child for elevated lead before they prepare to go to kindergarten. So there's all of these things around lead exposure environmentally, but it tends to be kind of within the household, right? So if you have an older home where the paint rules were different, and I'll skip number two because I'm going to do number two last, when it has to do with products, like I talked about, consumer products or baby goods, as well as food and either food sold here in the States or food that may be food or candy or even beauty products that you may have brought from your home country, and as well as the clothing or your shoes or something that may be tracking lead into your home or other pollutants into your home. Last, of course, but not least, would be lead in your water. And the reason that I kind of say that separately is because oftentimes when you're thinking of a solution and you're thinking about the health department, in some cities, you're hard pressed to get your health department to actually test your water. They'll come in and test your paint, but they may or may not come in and test your water. And a solution that we have uh, been working on and has been successful in one city, but we'd love for it to be successful across the country is Black Millennials for Flint has a lead prevention app, which can be found in the Apple Store as well as the Android market. And that is that it's only in the city of DC. Once again, we would love for it to be nationwide, but that's both expensive and complicated legally. But we have the ability for folks to go into our app and say, I think I need my water tested. I think I need something tested in my home, in my health department. It's taking too long, or I don't know who I'm supposed to actually reach out to. And that's also, before COVID, was a really great way for us to canvas volunteers, was to physically go to people's homes and gather some more information. But anyway, the reason I really wanted to kind of start with that is because you have all of these potential ways that lead can get into your home environment, through things that you've purchased, through your clothing, through your shoes. But if you don't know, you don't know, right? Like we put a lot of personal responsibility by saying this is happening in the home, but we're not, but some communities don't take responsibility for the fact that before people get into their home, they should be in a safe community. If you live in a place where they're building new homes, or new playgrounds or new schools. Unfortunately, a lot of times this is happening in places where gentrification is happening and the displacement of Black and Brown communities is leading to beautiful new condos that they can't afford until they're pushed out and other families can come in and purchase these homes. Well, that construction process is also exposing the people who currently live there to environmental particles, in particular lead and other pollutants in the air, right? So in the dust and in these construction sites. The folks that are breathing that in, the folks that are bringing that into their homes, are not the people that the city planners are hoping will still live there in a few years, which is quite disheartening to know. And so that's a part of our work. Is it's not just what's happening now while a child is a child playing in their home. It's not just what's happening while a woman is pregnant and living in her home, but did she recently move and what was going on in her community before? Things of that nature. So I wanted to kind of paint this picture of what a child's environment can look like, but then let's think about the child's not here yet, right? So what is the environment looking like while the woman is pregnant? What is the environment like before the mom has decided that she and her family want to grow with one more baby? What does this environment look like, and who can be responsible for protecting the health of her family and of her new baby if there are a variety of sources of lead that could be impacting her health, right? And so that's kind of why I like to start with that. And so then I guess the next question is, well, why is lead so bad? Like, what does it do? And so let me change my slide. So when it comes to kids, what we know is that it impacts their brain development and their nervous system. It impacts their growth. It impacts their ability to regulate their emotions. And sometimes it does result in slow development to making their milestones. And so that could be speech, that could be learning words, learning certain things that will prepare them for school, but also just to be a happy, healthy child, right? And so if you think about these type of exposures, or excuse me, these type of outcomes for small children happening if that child was exposed to lead as a child, what was the situation if their mom had been exposed to lead the whole time she was pregnant? What's the situation if she was exposed to lead before she even decided to get pregnant, while she was a small girl, while she was, developing herself? And so when we're talking about it being November 10th, 2021, subtracted to April 14th, 2014, and we're talking about a 7+ year period of adults, children, young girls, people who have had multiple children in this time frame, kindergartners who have spent that 5, 6, 7 year period of their entire life exposed to a neurotoxin, a very dangerous neurotoxin. We can't just talk about the outcomes of the child, and we can't just talk about the things that we've been talking about all these years. We have to look at what can we do, and what more can be done to protect this community and other communities that have these long-term exposures to lead. These slides, this data that comes from CDC, this is not new news, but this is also based on people that were only exposed to lead for very short periods of time, right? And now we're looking at something that has never been seen before in history, specifically not in the United States, where you have almost a decade of exposure, and we can't have this continue to happen, right? So I wanted to kind of, like I said, give you all that that landscape of what type of outcomes we have seen in children, as well as kind of how you can become exposed to it. I will also add one more thing, which is there's no safe level of lead for anyone to be exposed to. I remember when I was in middle school, and like mechanical pencils had kind of just come out. So I'm showing my age, and we would like pretend we were making injections of like, oh, you have lead poisoning. And like, it was kind of like a joke, right? But like, there's literally, whether you get lead in your finger, whether it's in your tap, whether it's in paint, there's no safe level of lead to be exposed to. And with adults, if you had it in your system, and as you grow, you can eat green leafy vegetables, you can do all these things to balance it out. But with children, that's not the case. With children, we're talking about high potency, we're talking about high concentration, and we're talking about complete protection and prevention for these children. So this slide is a little bit of context of what conversations are being had, not just with Black Millennials for Flint, not just with March for Moms and the other partners that are here today, not just with a variety of reproductive justice organizations who are outfitting their doulas and birth workers with additional skill sets to protect their clients and their clients' communities, but the intersection of different experts from different fields having this conversation about environmental impacts of racism, environmental impacts of climate, and how this is literally specifically impacting moms. And so, one thing that is I would say talked two things that I think are talked about in, I guess I'll say, in the circles I'm in. So I'll bring those to you all, would be the impact of environmental stress, as well as very specific outcomes around early and small babies. And so when Black Millennials for Flint thinks about partnerships and thinks about how we can be more impactful, we do lean on these organizations and individuals who are doing work around preventing premature births, preventing small babies, babies not only being small in utero, but being small when they come, when it's their birthday, and environmental stress. And environmental stress is something that I think now is being taken a lot more seriously. But when you already have the stress of your community being treated like a landfill and your community being treated like a place that should be dumped on, and then adding the stress of, I have a 12-year-old son and I don't know if he's going to come home tonight because the police are shooting people or I have a daughter who's sleeping in her bed and I don't know if she's going to wake up because who knows, the police are shooting people, right? So you have all of these types of stress that are impacting families and communities, and on top of that we're adding extreme heat. On top of that, we're adding pollution. On top of that, we're adding lead in the water and lead in your pipes. And so there are these compounds of justice that need to be addressed. And I'm going to talk a little bit about the different frameworks that are impactful for folks who are in so many different fields. But of course, I want the take home to be for our illustrious birth workers. So I know, these are just a couple of events that we did. I will say something that Black Millennials for Flint really took advantage of during shelter in place and quarantine at the beginning of 2020 was building alliance with organizations across the country and actually across the world that maybe weren't initially in our network. Much of our work was in the Northeast as well as in the Midwest, just because of the nature of the work that we were already doing. But we became very, very lucky to have be invited or to kind of organically build relationships with folks as far as California and Seattle. Of course, I'm biased because I'm from Seattle, and folks in small towns or rural areas who are like, hey, what's going on in our community is being overshadowed by the larger city in our region, right? And so we really tried to tackle some of the issues that we found were important, but didn't have our hands on once we now had this virtual world, which of course we're all also experiencing right now with this presentation. And so we had the ability to connect with elected officials. We had the ability to connect with physicians, obstetricians, and of course, nurse midwives and others, and have conversations for any of these, as well as other updated flyers that aren't on here. Please check out Black Millennials for Flint. We're on YouTube. And so we do have a playlist that has all of our conversations, including our trainings around maternal health. And I'm biased, but my favorite is around father involvement in prenatal care and postpartum care and lactation and anything kind of bringing dads in. Our Dad Docs and Doulas event was one of my favorites, and it's a multi-part series. And so, like I said, I'm a little bit biased when it comes to that, but I love to have father involvement. So what I want to do right now is show a brief clip, a 2-minute clip of an organization that's the one really doing the work, like Revive Community Health Center, as well as their partners with YOLO, which is You Overcoming Lactation Obstacles. I love that. And they are 2 Flint-based organizations that we partner with that are wraparound services for moms. And so this 2-minute clip will really highlight the work of Katrina Tillman and Shantae from YOLO, as well as hopefully inspire those of you who are looking for tangible ways to make some impacts in your community. So if you give me 1 second, I'm just going to change my share to my other tab and play this video. Please let me know if the audio does not come through, but I'm feeling very optimistic that it will. So we'll do share screen. Great. Thank you for your patience with technology. It's always nice when I know folks kind of understand. Okay, so I'm going to play.
Climate change definitely affects Black communities different than white communities simply because a lot of the injustice takes place, unfortunately, in Black communities. History has shown within the African American community, these corporations like to build their businesses where children have to breathe in and be directly affected by whatever it is that they're producing. But yet, you don't see these same type of factories in white communities. At the Revive Community Health Center, I'm the executive director, and we are really focused on making sure that we provide and address the health disparities, especially within the African American community, especially with women and children, addressing the infant and maternal mortality rate. Environmental justice and Black maternal health are definitely connected. When you think about the air that we breathe and how that gets transferred to our children that we're carrying as mothers, when you think about the water that we drink and how that gets transferred to the child that we're carrying. The risk within the Black community, if we don't take action now, is simply failure. And so this is why we need white allies and other nationalities to take on this fight with us so that we can begin to eradicate it. One of the things that moved me to vote for Joe Biden in regards to climate change is the fact that he acknowledged it. I think that's the first step to any change, acknowledging that there's an issue. And far too often, environmental injustice has been viewed through the lens of whiteness. People on a grassroots level need to have a seat at the table. Regardless of the community that you happen to live in or work in, at the end of the day, you're a human being, and it's your human right to have clean air, to have clean water, and things of that nature. And so, for me, environmental justice looks like a level playing field that's balanced for all nationalities.
Thank you for watching that video with Katrina Tillman, the First Lady at First Missionary Baptist Church in Flint, Michigan. She has raised all 5 of her children in Flint. She was in my cohort of the Lead Prevention Ambassador Program, which I'll talk about a little bit later. But she's also somebody who has been absolutely relentless for protecting children and mothers in her community. And Revive is a fantastic organization that is providing wraparound services in the city of Flint. And so I really wanted to highlight her work and encourage anyone to partner with them if you're interested. And I'm going to talk a little bit more about her when I talk about the 5 ways that doulas show up in the movement. Let me get back to my slides here. Okay. So in that video, you mentioned, Katrina shared, the importance of not just the importance of acknowledgement of what's going on, but also, like she said, environmental justice is an issue of us being human beings. This is a human right. Having clean water is a human right. Being able to protect your family from environmental exposures, toxic environmental exposures, it's not something that should only be afforded to certain types of people. And I also like that she highlighted, that it's not just our work, but that it's the work of white allies and elected officials and others to really be a part of the solution. So the slide that you have in front of you, for those of you all who are in public health, have probably seen this before, but I really wanted to talk about levels of prevention as it pertains to doulas and the scope of care that doulas provide. This framework is created by Dr. Kamara Jones, who is one of the most impactful thought leaders of our generation, let alone well, I guess of her generation, but one of the most important public health thought leaders. And she has shared this idea of different types of prevention. And so when I think of doulas and their scope of care, I think of a doula, whether they be a birth doula, postpartum loss and infant loss and pregnancy loss, death doulas, preconception doulas. It doesn't matter their level of expertise, but a doula can actually come in and be a part of the system of prevention at so many different points. And so I just want to take maybe 30 seconds to a minute to talk about the 3 levels of prevention that are oftentimes discussed in public health intervention, and then talk about how this, and kind of give examples of how this aligns with the expert scope of care of doulas and birth workers. And so when we think about prevention, and specifically, I'll talk about exposure, preventing toxic exposure. There's 3 ways we want that to not happen. So primary prevention is you are not coming in contact with this thing, right? So this may be, if we're talking about lead in the water, something as simple as the water that comes out of your tap being clean and being non-contaminated. Okay, well then you're not going to come in contact with, you're preventing your exposure to lead in your water. Let's just use that as an example. Then there's secondary prevention. Let me start by saying in this graph, what you'll see is for primary prevention, 2 couples. You'll see a couple who's far away from the edge, right? So they're not even getting to the edge. So I would say they are a group of people who live in a community where the officials know we're not going to expose these people to contaminated water. So they're not even going to get close to the issue. But just in case, there's a fence there. So that fence may be, filtration. That fence may be a variety of things that are done to prevent them from having that exposure. But of course, you see the couple that's closest to the front, they don't have a fence and they're close to the edge. So they're in a community where they are potentially more likely to be exposed to something, right? In this case, like I said, I'll use the lead in the water example. So primary prevention is don't even get that family or community or individual close to the issue. Then there's secondary prevention. So that's safety net or wraparound, right? So maybe the community has already been exposed to something. And so how do we prevent it from getting worse, right? How do we catch them mid-fall? I would place, I would place organizations such as Revive in that position as well, where they Katrina Tillman and her team, Shantae and everyone else over at Revive, they have families who come who have already spent the last 7 years in a position where the prevention was not there for preventing their exposure to contaminated water. But now they can come to Revive. They can obtain clean water from the water box. Shout out to Jaden Smith for that. They can come and get free doula services there, lactation services, if that is something that their family chooses to do. And they can have these wraparound safety net that will prevent further exacerbation of the issue, right? Further exposure to the problem. If they know they're turning on their taps and the taps are contaminated, a secondary prevention is let me run down to Revive real quick and get some water, right? And so then tertiary is literally the treatment side of things. When the first few published articles came out about the impact of the Flint water crisis, one of the most dynamic findings were that the outcomes for miscarriages and fetal deaths were 5 times the rate prior to the water being switched to the Flint River. They were 5 times the rate of nearby cities. The outcomes for mothers and the outcomes for their pregnancies were terrible, and were nothing to ignore. Yet there are literally to this day a lack of services to address this not only physical issue that was caused and that these women physically experience, but the grieving process, right? Like the restoration process of families and communities. We are in a time where once something happens, it's almost like there's this cleanup process just for the media or just for conversations. But what about these families who literally have to put things together step by step, brick by brick, right? And so this idea of rebuilding your physical care and getting a different type of obstetric and gynecological care. The slide I showed before, the type of care that the children are going to be getting from their pediatricians, or some of them may end up needing special education services. This is, I don't even know why it's called tertiary prevention, because it's almost like treatment processes, but there are situations where you get all the way to that point. And the reason I wanted to show this in the scope of care is because doulas come in all 3 of these places. There are doulas who are, we already talked about primary, where, you have doulas who have the skill set to come in and say, okay, for instance, here's this app, or let's contact the health department, or there may be something that we need to do to make your environment more safe during your pregnancy or after your baby comes. Tertiary, we talked about wraparound services and organizations such as Revive, or even with Black Millennials for Flint, right? Partnering with us to figure out a way to get those type of services in your community if such doesn't exist, or you don't have a good relationship with that. And we'll talk about building these relationships. And then completely creating or maximizing off of the ability to actually address poor outcomes after the outcomes have already presented themselves. And I think postpartum doulas definitely fall in this category of, in particular, with families who already have children. We work with an organization called called Mom Cares in Baltimore, and it's specifically a doula organization for moms with children in the NICU. And so this idea of, well, the challenge has already presented itself, but how do we address the family is particularly valuable. I know I'm running short on time, and so I'm just gonna real quick go through the next couple of slides. So with our Black and Brown, we have a program called the Black and Brown Alliance for Maternal Health Equity, which is specifically Black and Brown organizations that do work in this space. And we come together and introduce the environmental justice side of things. 30 years ago, just this October, was the creation and development of the 17 principles of environmental justice. I do encourage you all to go check that out. And I'm also going to have a resource for you all to access that digitally. We're a group of folks of different people of color from different backgrounds came together and met and said, we're going to establish a way to demand respect and protection as it pertains to environmental justice 30 years ago, right? And so this is not new with, Greta Thunberg and her whole crew. No, this is something that we have been fighting for since at least even before 30 years ago, when we didn't have a name for it. And obviously we know Indigenous communities have been laying the groundwork for protecting this earth and protecting human life for hundreds of years, but have just, not, because of racism and a variety of other things, have not been respected. And we are not taking their wisdom the way that we should. And now we're trying to fix it, right? Tertiary prevention, right? Reproductive justice, another term and framework coined in 1992 by 12 Black women and women of color in Chicago, another guide for our work with Black Millennials for Flint, and then 2 other documents that are out there. And like I said, another resource I'll share, the Black Birthing Bill of Rights from National Association to Advance Black Birth, as well as the Birth Justice Bill of Rights, which has about 22 statements around Respect and from Southern Birth Justice Network and Mama J down in Miami. And so the 5 ways that doulas show up in the movement, and I have notes for this, so hopefully I can do it without my notes because I don't want you all to see my notes in the tab. But there are 5 things that doulas already do and that we want to empower you to continue to do. And these are build relationships and continue to nurture your relationships with elected officials. Be and continue to build relationships with community organizers. Be or continue to build your relationships with community activists, which is not the same thing as community organizers. Be an advocate or bring advocates on to your team. And then, of course, the 5th one, and then build relationships with power brokers. So real quick, I'll just run through those. So elected officials, we have a representative by the name of London Lamar in Tennessee. We're super proud of the work that she does, but she actually passed a bill that stated during shelter in place, during quarantine, when there were all of these changing rules about the birthing suite, who was allowed to be there, who's considered a part of the care team, et cetera. She passed a piece of legislation that said doulas are essential workers. Doulas are an essential part of care in the state of Tennessee, and you're not going to deny them the right to be present, right? And so when you have elected officials that you have relationships with or are doulas themselves, you have the ability to truly show up and make these impacts. The second one was community organizers. So like I already mentioned, the example of us and the Urban League, young professionals, right? So they are a community organizing organization. So they do the logistics of things, which is not the same as being an activist. I'll say that in a minute. But having the resources to say, okay, we can get a building, we can get a truck, we can get Target to drive bottles of water to, that's the community organizing. It's not just the idea or the message. The idea and the message comes from the activists, the community activists, which I think many doulas are innately already, community-based doulas are already kind of innately activists, where they became called to this work because they wanted to make a change. They had a message and they had people to listen to them. But that doesn't necessarily mean that they have the other resources to push that message forward. And so that's why we talk about these other folks. Advocates would be, I'm going to go to my next slide real quick. Advocates would be somebody that works in an organization that can bring your message to another audience. We are fortunate that our president and CEO, Latricia Adams, is the only Black woman of reproductive age in the White House Environmental Justice Advisory Council. So she has direct access to the president, the vice president, the EPA, all of these folks, the Black Maternal Health Caucus, right? To say, we're talking about the water and saving the whales and all these things, but are we talking about saving these Black women when we're talking about the environment? And so she is someone who is an advocate. She also does this in Shelby County schools, who can take that message from the scope of work that doulas do in birthing suites in people's homes to the folks that can actually put this in writing. For instance, we recently, and I know this is probably hard to see, so I'll get this to you, but prior to the election of President Biden and Vice President Harris, we created White House recommendations. No matter who won, we were saying that there are 4 patterns of injustice, which is the intersection of environmental racism and maternal health, unequal access to quality health care, maternal and infant mortality and morbidity, as well as discrimination against birth workers, that needs to be addressed by this next administration. And we also put together 8 very specific recommendations, but we didn't write this. Black Millennials for Flint, we didn't write this. We had a dozen community organizations, doulas, elected officials, and all of those other people that we mentioned, right? Advocates, community organizers, activists, elected officials, and power brokers, which I'll define in a second, to write up these recommendations, make them go viral on social media, get folks to co-sign on. And now we're fortunate enough that these recommendations are actually in front of the eyes of President Biden and Vice President Harris, because we have somebody in the position to make those recommendations. And so that 5th one that I mentioned, a power broker, is actually someone who has a position of power in that community, right? I'm not from Flint. Our organization did not start from people from Flint. It started from people living in the DC area. And so we needed to get people that lived in Flint, that knew what was going on, to tell us, well, how can we really help? How are we going to be genuine in coming in and trying to be a part of the solution if it just looks like we're outsiders coming in? Well, Katrina Tillman and her husband Ezra and a variety of other organizations were like, well, talk to us first of all. Let's vet you, and then let's see if this is really a good fit, because you guys might just be in the way. And a lot of times when you're trying to be a part of the solution, you need to know when to step up, but also when to step back, because you might just be in the way. And I know some of our white allies have probably kind of dealt with that intersection a lot, where we're like, hi, we know you're here to help, but you're kind of in the way. And so, but that happens with Black organizations too, where we need to be told, okay, we have power, you don't. How do we navigate that? If the solution to the problem is or if the solution is we're trying to address this issue that we both are passionate about, or that we're both trying to make an impact at, right? So I think I'm 5 minutes over, if I'm not mistaken, and I know that was a lot. So what I did was I created a community resource for everyone to have access to kind of go back over some of these things that I briefly grazed over. Also to access some of these documents, as well as some of these exemplary organizations and exemplary scholars who have built a platform for us to lean on. And lastly, thank you, Morgan, for giving me the giving me the hook, right, on the Apollo. But lastly, we are a resource. Black Millennials for Flint is a resource to you. One of the reasons why we're in Memphis, Tennessee, one of the reasons we're in Baltimore, Maryland, is because people reached out to us and was like, what is going on? When Corinne Gaines was murdered, she was a mother protecting her child and was murdered. And we also did deeper follow-up to realize that was an environmental issue, not just because of the poor relationship with the police, but she was a woman who had elevated lead levels in her system as a child. Same thing with Freddie Gray, right? And so if you need us, you know where to find us. That's our website, our email. We're a lot more responsive on Instagram, Facebook, Twitter, and of course our YouTube. And thank you again. And thank you for dealing with technology and with the delays. And I hope you enjoyed this entire March for Moms event. Thanks, Morgan.
Thank you so much, Vanessa. I mean, you covered so much in this hour. I mean, you brought up the intersections that comprise maternal health outcomes, especially when you consider the very zip codes that we live in, right? Our most precious resources that keep us alive. Climate justice, recognizing the correlations of police brutality, you name it. So, one question I have is, have you had any luck in larger institutions like birthing hospitals recognizing the intersections of social determinants of health? And have you encountered medical and clinical champions of a public health response? Like, have you seen robust community based referrals in place? I'd love to hear that.
That's a great question. So we get that question a lot, which is how can I'm going to rephrase it to what we hear a lot is like, how can our community hospital do a better job? Or what can we do to convince this particular, company or a privately owned hospital chain to do better? I would say that we have had a couple of victories in a couple of different ways. It is very hard to penetrate kind of these hospital systems, because at the end of the day, they're trying to protect themselves from lawsuits. They're trying to protect their doctors. And so oftentimes if there is an issue of obstetric violence, it's what did she do, to intimidate the nurse, or, or something like that. And we don't want to get into litigation. That's not our role, right, in the solutions. What we have seen work is partnering with medical schools, right? And this idea of, well, how do we re-educate the next wave of healthcare providers? We've had success, like I mentioned before, partnering with elected officials that can do their part in making impacts in their jurisdiction around policies in healthcare that maybe we can't necessarily touch. Something that we hope to do but haven't had success yet is look at recommendations that are made by some of these larger organizations like ACOG, right? Or like the American, now I'm forgetting the AmChip, like AmChip, and they have a fantastic CEO and executive director right now that's doing a ton of work. But the folks that people turn to say, well, what are the recommendations for care for moms? If it's anti-racism or if it's anti-exposure, it's something that's a little bit hard to talk about from a clinical standpoint, they turn to those folks. So when it comes to recommendations, we want to influence what they consider the standard of care. We want to influence what they consider the recommendations for providers. And like I said, we have had success on a smaller scale working with med students and working with elected officials, but with hospital administration or organizations like ACOG or AMCHIP, we are trying to develop, and if anyone's out there, we want to develop a relationship because we have a host of Harvard trained environmental scientists, Howard University trained environmental scientists. We have PhD holders in our organization. We are actually a group of nerds and researchers and scientists that are also happen to be activists, that also happen to be heartbroken Black people, right? And so if we can use our resources to help those folks do their work better, that's all we really want to do.
I love it. I'm so inspired, and I'm definitely going to keep my eye on you so I can vote for you in the future.
Gosh.
Thank you so much.
Thank you,
Um,
Morgan.
Time flies when you're having fun. We're almost at the end. I'm going to pass it back to Lanicia to take us home.
Thank you, Lanicia.
Come off mute. Thanks, Vanessa, for your presentation and compiling this information in a handout for our attendees. We truly appreciate it. We hope that you enjoyed your time with us and are able to take some of the information you learned today back to your organizations and communities. I also want to send my gratitude and thanks to our amazing speakers who presented here today, our live entertainment, and members of the steering committee who you all got a chance to get to know during introductions that helped me put this wonderful event together. I also want to thank our sponsors, Sage Therapeutics and the Jewish Healthcare Foundation, for their support. We could not have made this event a success without all of you. And I also want to thank our attendees for sticking with us through all of the technical issues that we experienced throughout this workshop and just being here to support this event. And we hope to see you all again next year. So I hope you all take care and enjoy the rest of your day.